Shar Michelbust. She'll be presenting on stress and anxiety in youth. And this is a program that we put on. It's a joint program with Prairie Care, the school district, as well as Health in the Park with Park Nicollet. So I will let her get started.
Hi, everybody.
Hi.
Welcome, and thanks for coming tonight. Our topic is stress and anxiety. And I'd like to tell you just a little bit about my background before we get started, and I'd like to learn a little bit about you as well. I worked in Intermediate District 287 for the last 15 years, and that's a consortium of school districts in the West Metro region that serves districts all the way from Richfield to Osseo. And we work with kids who have low incidence disabilities, so kids who have autism, kids who might have pretty significant mental health kinds of struggles, children of developmental disabilities, that kind of thing. So that's what my concentration has been the last 15 years. And then prior to that, I worked in the area of mental health. I was a counseling clinic director at Hazelden. And then before that, I was a classroom teacher with kids who have emotional and behavioral disorders. So I've spent my whole life basically working with kids who have faced challenges, and it's been a very rewarding career. And I say has been because I retired last year, but now, as all good retired people do, I went off and do consulting and, speak at conferences and that kind of thing. So as far as you are concerned, how many of you are here because you are professionals who work with young people who have stress and anxiety and you're just interested in learning more about the topic? Okay, we have a few of those. And how many perhaps, and please don't feel you have to raise your hand, but if you feel like it's okay that you're concerned about a family member or you know a child who has anxiety, okay, great. And then somebody who just walked in off the street because you had nothing going on tonight and you thought you might stop in this room. Anybody I've missed? Okay. Well, with that, we kind of have a mix of people then. And, even those of you who are here for professional reasons undoubtedly know a child in your family or a neighbor or somebody to whom you are close who may struggle with anxiety or struggle with stress. So that's what we're going to be talking about tonight. And welcome to those of you who just came in. So where to start? I think that I'm going to start by giving just a little bit of an overview of the physiology of the brain because it's really important to understand how the brain functions in order to understand the context for anxiety. So this part of the brain is called the cerebral cortex, and it's about the thickness of a tongue depressor, and it covers the whole outer part of the brain. It's sometimes referred to as the upper brain. And it's so crinkly like that because as people evolved, as humankind evolved, it kept growing. We kept getting smarter, and the brain wasn't large enough to have it be a smooth cover. So it has all of these areas that are called gyri. Each one is called a gyrus, and it's where there's a fold and kind of a snake-like structure. And each of those folds has a specific purpose in the brain, so a specific function. That said, even though there are areas of the brain that specialize in various feelings and learning activities, our brains are pretty cross-communicative, and so there are many areas of the brain, for instance, that are involved in learning. It's not just the frontal lobe. There's a lot that goes on back here in the motor cortex. There are things that go on with feelings related to learning, so we'll talk about all of that later. So that is the cerebral cortex. Then if we just looked at the brain and we looked at it from a sliced perspective, this part of the brain, if we're facing this way, is the frontal lobe. And that's the part that we've learned so much about with teenagers and with toddlers in the last, I would say, 25 years, where we've really become smarter about the function and the importance of that particular lobe. That is the part of the lobe that has to be engaged in order for learning to occur. It just has to be accessible. And there's a reason that that part of the brain is not accessible when children struggle with anxiety. And I'll talk to you a little bit about that later. Then we have the temporal lobe, and that's the part here behind the temples. And then we have also back here the occipital lobe, and that's where our visual images are processed. And then we have the parietal lobe, which goes across the brain like this, and that's responsible for fine motor movement, some social perception, that kind of thing. Then if we look at the brain stem, That's really getting to the primitive part of the brain. There is an important thing here, though, that I want to show you, and it is this part of the brain right here. That's called the cerebellum, and that hangs at the back of the brain like a bell, and it's responsible for motor movement. It activates when we have motor movement going on. The reason that's so important, and this is very related to anxiety disorders, when kids are moving, their brains are engaged. So anytime we can have kids move, it helps them get off the dime, so to speak, with their stress and their anxiety. So that's why it's important to say things like, let's take a walk, let's walk and talk, you know, let's do some breathing, let's do some cross activities when we're walking down the hall. All of those things are important because they engage the frontal lobe of the brain. So it looks like it's recess, looks like it's phy-ed. It's really very smart activities. So we need to know the importance of motor movement when we're talking about children with mental health struggles or just challenges with stress. If it's a child who doesn't have a significant mental health disorder, it could be what sometimes is called a shadow syndrome. There's an author named John Rady, and he wrote a book actually called Shadow Syndromes. And that is the phenomenon that we all carry around a little bit of everything. And when I was working on a doctorate degree in psychology, we'd be in class and we'd be studying depression, and everybody would look at each other and say, I think I have that. And then the next month it would be bipolar, and we'd say, no, that's what it is. And then it would be anxiety disorders, and well, I have that too, you know. So we all identify with some of the signs and symptoms of all of these mental health disorders. The really important thing to look at is, you know, how intense are those symptoms? What's the duration? What's the frequency? So if people are feeling stressed, a lot of the time it's very intense and it lasts for a long time. That's when we should pay attention to it. All young people have their days and meltdowns and that kind of thing, and that's perfectly typical. Nothing to worry about. But we want to pay attention again to that intensity, the frequency, and the duration. Those three things are the important things to watch for. So there's the brain in a nutshell. So just the basic functioning in terms of the functions of the lobes. So when we're looking at the brain, what's exciting now that we can do that we never used to be able to do is we can look and actually see the brain at work. And years ago, physicians might take an x-ray of the brain. And, yep, there's a part missing, and yeah, that probably is a problem. But we really didn't know the sort of the day-to-day functioning of the brain. And now with the new technology with brain scans, PET scans, and SPECT scans, MRIs, functional MRIs, all of those kinds of tests, we can actually see the brain at work. So in this particular scanning photo, what we're looking at is we're looking at a brain that is completely engaged. And the way we know it's engaged is all of these yellow spots that are lit up on this particular tomography show that the brain is active in those areas. It's metabolizing glucose or sugar and water, basically. And so when the brain is working, that metabolism is occurring. So that's the frontal lobe, and that means that this person is thinking when the scan is occurring. We're looking at them processing some visual images because that's the occipital lobe in the back of the brain. So when we're looking at a picture like this and the person's feeling, we're looking at this deep feeling system. What might this person be doing? So if you turn to 2 or 3 people, whatever your logical grouping is here, and just talk a little bit about what do you think a brain is doing when it's processing in the frontal lobe, when it's having some sort of images, when it is processing feelings, and when there's some activity involved in the oral part of the brain, hearing. So when a person's brain is engaged like that, what do you think might be happening that this person is responding to? And there's no wrong answer here because this could be a number of scenarios, but I happen to know what this person is doing in this particular one. So talk among yourselves, and then we'll come back and we'll see who has some ideas. Does anybody need more time? Okay, then we'll ask for a couple contributions to the large group. Who wants to hazard a guess about what this person might be doing when their brain is lit up like that?
Singing or dancing.
Singing or dancing. Okay, great guess. Anybody else?
Dreaming.
Dreaming? Could be, yeah. All those things could be happening in a dream, yeah. Remembering, reminiscing, thinking about past events, and then there was contribution. Watching a movie, okay. So, bless you. All of those are distinct possibilities with this particular scenario. In this case, this person was listening to a complex piece of music that had a message, a social message, and that evoked feelings in that person. So think about a song that really gets you to think. I'll throw out some examples that'll date me, but things like Bye Bye Miss American Pie, or there was a song at one time, a country song called Billy Joe McAllister jumped off the Tallahatchie Bridge, and it was kind of like, what really happened there? You know, it was a story, and it evoked feelings because it seemed kind of sad. Somebody jumped off a bridge or was thrown off a bridge. So what was that about? So those kinds of songs really activate our entire brains, which is why using music with young people is so important, because it really taps every aspect of their brains. And in brain-based teaching, if any of you know a really good brain-based instructor, they activate all these parts of the brains. They get the kids moving. And a rule of thumb, by the way, for movement with kids is that they should move about every a few minutes according to their age. So kindergartners, every 5 minutes should be doing something that could be categorized as movement. Even if it's just clap 2 times, change seats, give your partner a high five, say, yes, this class rocks, whatever it might be, but getting kids moving and involved. We can tolerate a little more sitting still as we get older, but even adults should be moving every half hour at least, and possibly even more frequently than that. So we always have to interweave movement into any kind of sedentary activity, because we want the brain to be engaged. So when we're looking at the adolescent brain, I just want to illustrate some differences between the adolescent brain and the adult brain. And these differences also are accounted for in younger children, but there's something particular that's going on related to hormones in the teenage years. So in this particular case, this young adolescent girl, we see a part of her brain that is called the amygdala. And the amygdala is the part of the brain that pays attention to novelty and danger. And the reason that part of the brain is so important is that in kids who have anxiety or who experience a lot of stress, that amygdala is on, I call it, all of the time, hyper alert. If any of you have children who suffer from anxiety disorders, or you know others who do, sometimes we'll observe kids and we'll think, boy, they just went from 0 to 60. That's not really true. Their amygdala has a resting state that I would call a 59, which means it's hypervigilant, watching for things to worry about, watching for bad things that might happen. And so something that is seemingly innocuous can tip it to what looks like 60 miles an hour from 0, when internally that child has been resting state at about a 59. Kids who experience chronic stress and anxiety have a resting heartbeat that's much faster than a typical heartbeat. So they're just ready, poised to have an outburst or a meltdown. The other thing that I would point out about this adolescent girl is this frontal lobe, this frontal part of the brain is not developed yet. And we know now, of course, that the frontal lobe develops at around the age of 25. And then let's think about that when we think about how old you need to be to have a driver's license, to drink, to join the military, to vote. You know, all those adult-like activities are permissible way before the brain is done cooking. So we just have to be aware that young people are going to make some errors and missteps in life. Their brains just aren't done developing. It's predictable. Another part that I would point out in this particular illustration is right here next to the amygdala is a part of the brain called the hippocampus. And I teach kids to remember this by just memorizing that it's where hippos go to school, the hippocampus. And the hippocampus is so important because it's the short-term memory part of our brain. And short-term memories are encoded and filed away in long-term memory when there's enough repetition, when that memory is called up a lot, when there's a traumatic event and the memory is really powerful. The reason that bad things are remembered so well is that the hippocampus right here lives right next door to the amygdala. And the amygdala, again, is that part of the brain that pays attention to danger and novelty. And there's a biological reason for the brain to do that. The brain wants to survive, wants us to survive. And so if I pay attention to things that are dangerous, I'm going to try to protect myself. I'm going to notice them, and I'm not going to be lackadaisical about a threat that's looming. I might fight, I might freeze, I might flee. I could do any one of those three things, but my brain is going to try to save my life. So whenever you hear a child talk about remembering negative things, that's a biological function, and we have to work extra hard to infuse positive memories and positive thoughts. Even doing activities like let's pull out a photo album and let's go over that last trip to Disney World or hiking in the Boundary Waters or whatever the experience might be, and infusing happy memories. We need to do that intentionally because our brain is wired to remember things that might harm us. Think about 9/11. For those of you who were around then, I always have to update my stories because one time I learned years ago, I said, who remembers where you were when John F. Kennedy was shot? And nobody raised their hand. And I thought, wow, I have to move on. So then I moved to 9/11. Now I might move to Paris, the Paris attacks, the terrorist attacks, or Columbine, but something that was fairly recent. Now Columbine's getting kind of old, but something that was fairly recent that was a traumatic event for the world. So I'll ask you, let's just do let's do Paris, the Paris terrorist attacks. How many of you remember hearing about them, first of all, and then if you were watching TV or with a friend or on a walk or, just your first memory? And, I'd say about half the rooms raising their hands. When I would ask about John Kennedy, when people were old enough to all remember that, nobody didn't raise their hand. Everybody raised their hand. It was such a cultural impact, that assassination of John Kennedy. Martin Luther King, same thing. People just remembered it. What I remember specifically about 9/11 is that I was at work in my office, and my colleague Paul called me and said, "Did you hear what's happening on the East Coast?" And I said, "What, a hurricane?" I remember the conversation. And he said, "No, it looks like it might have been a terrorist attack. They're saying it was an airplane flying into the building, but I don't know." He knew right away that something was very wrong about it. So then I remember we all turned on the television set in our district office and stood around, and a lot of people were crying and, had relatives in New York City, some who worked in the World Trade Center, very concerned about it. So we remember those things. I can't hammer that point home hard enough because that's what's going on with kids who are stressed and anxious. It's automatic negative thoughts, worry. In fact, there's an excellent book called Worry. There's also Daniel Amen, A-M-E-N, writes a lot about worry and automatic negative thoughts. So that's an author I would encourage you to read. And he's also a psychiatrist who does these brain images that have been so helpful to all of us in learning about mental health disorders. So if we were to slice the brain in half, and don't try this at home, but if we were to, this is what it would look like. And this is a brain that's preserved in formaldehyde. Our brains are typically sloshy, like oatmeal. They're almost the consistency of oatmeal, and they slosh around in the brain. Very delicate. And it's why there's all the controversy now about head injuries and concussions with football players, because the evidence is mounting that repeated impact to the brain is very harmful to long-term mental health functioning and some physiological kinds of issues as well. What I wanted to point out here is that this is that cerebellum that looks like a cauliflower, and that's the movement part of the brain. Contains over half of the neurons in the brain. So again, athletes are smarter than people who are not athletic. People who exercise build brain capacity. If there's any one reason to exercise, it's to grow your brain. Now there are some NFL players who belie that particular statement that I made. However, remember what we just talked about, the concussions. And so if people are athletic and don't damage their brains, tend to have more cortical mass than others. Musicians, anything that exercises the brain in ways that are beyond the typical daily functioning. The important thing is to learn novel things every day. Something new every single day is important to build the capacity of the brain. When kids have anxiety, the more options they have to calm themselves, the better. So think about the anxious child. If they can say, okay, I know deep breathing, I can do that. I can do the tree pose in yoga. That's a possibility. I can call a friend. I've learned about journaling. I know that I can go out in nature. There's a new therapy intervention now. It's not even really therapy, but it's more like coaching, called nature bathing. Forest bathing. And I have a friend who's training actually to be a forest bather guide. And it's taking people into nature and having them have a new way of seeing nature and experiencing nature. It's like a mindfulness thing. Mindfulness strategies, which is becoming a very evidence-based approach to working with kids who have anxiety disorders or people who are experiencing stress. Mindfulness strategies, which are a part of social emotional learning, are evidence-based in that they improve school connection, they increase academic achievement, they help the child perceive him or herself in a more positive way. The teachers who work with the kids see the kids in a more positive light. So all kinds of outcomes that are pretty irrefutable. Huge studies out of the Collaborative for Academic and Social Emotional Learning. So what I would do is choose an evidence-based curriculum as a teacher, choose an evidence-based curriculum, teach my children all of these strategies, and even interweave those strategies with content. Because that's, it's a way to teach rather than a thing to teach, And so helping kids know that if they're reading a novel, say there's a novel that's, 6th to 8th grade, probably middle school novel called Slake's Limbo. And it's about a young man who lives in a subway. And to talk with them about, how do you think he feels? What about when somebody who's kind of scary looking walks down into the subway and he sees them? What do you think's going through his mind? What could he do to calm himself? As a parent, what I would do is teach strategies, actually from Goldie Hawn's book, 10 Mindful Minutes. Goldie wrote a book because she used to use these strategies with her own children. And she actually founded an organization that is a foundation for children and sponsored a curriculum called Mind Up. And Mind Up is a way to help kids pay focused attention in the moment without judgment. And that's such an important skill for kids who have anxiety disorders. Here's an example of what an activity from Mind Up might be. For all of us to, right now, let's do this, pause, and just take a couple deep breaths, in and out, and in, and slowly out. It's all about the exhale when you're doing breathing. And pause for a moment and look around the room and see if you can identify 5 things that you didn't notice when you came in here or when you sat down. Scan the room and see if you can see 5 things you didn't notice when you came in. That's a great strategy to use with kids with anxiety. First visit to a doctor's office, getting ready to go to the dentist, starting a new class. As a teacher, the first day of school, I would spend that whole first day on mindfulness stuff. Who can identify where the poster is that shows us how we problem solve in this class? Who can point out the exit when we have a fire drill? Let's see if we can find where the office is. Going through all of that stuff that first day really takes care of a lot of the anxious outbursts later on, the meltdowns, as it were. I have a friend who was a kindergarten teacher, still is actually in Vancouver, and she used to have to take her little kindergarten students to get shots, inoculations, in the office because that's how they do it in Canada. So she would line up her little kindergartners, and they were all crying and fearful and having meltdowns, and it was awful. And she decided to take them through a mindfulness activity. So what she did is she had the school nurse come to her class a couple days before and said, let's everybody take our thumb and our finger and go to your arm right here and pinch it as hard as you can. And we can all do that. Just pinch it as hard as you can. You'll have some black and blue marks, some of us. But and then she said, so what was that like? And then the kids said, well, it's kind of like a mosquito bite. Or it was like I got my skin caught in a door. You know, they had different ways of explaining it. And she said, and how are you doing right now? Well, it's okay. You know, it's stinging a little bit, but it's okay. Well, that's what it's going to be like when we get our inoculations. It's exactly what it's going to be like. So basically, you've already done it, but we're going to go do it again. But you just rehearsed for it, and you know what it's like. So when she brought her kids to the office, she was telling me that the other teachers were standing and just watching in amazement because their kids were just marching down the hall to get their shots, and they came out and they marched right back. And they said, what did you do? And she said, I took them through the activity in a mindful way, and they experienced it. And that's a wonderful thing to do with kids who have anxiety, is rehearse things before they actually have to do the real deal. So anything related to mindfulness, relaxation, guided imagery, all of those kinds of activities are really important. But I'll tell you the most important activity, and sometimes it's the recommendation that adults are a little uncomfortable hearing, we need to change our responses, and we need to be mindful. We need to check ourselves. And have you ever been in a situation where kids start to escalate and you feel you're taking the trip right with them? Oh, yeah. And actually, my granddaughter will probably tell you that I did that last night at her birthday party. She's sitting on the floor over there. But it was like, it was chaos, and you know, kids were running all over the place. And I had this moment where I got impatient, and then I thought, wait a minute, it's the kid's birthday party. Really, I'm grown up here. I can calm down and be mellow with this whole thing. But we find ourselves kind of going along with the ride. So we have to monitor our own heart rate, take deep breaths, ask a colleague to spell us. If it's your spouse, ask your spouse to spell you. You know, I got this right now, you go take a break, is really important in a relationship when you have a child who has an anxiety disorder. That part of the brain, and this was like a couple years ago, but that part of the brain is when I was in graduate school. I was in a brain slicing class, actually, and that is that little memory center of the brain, the hippocampus. Here we have the limbic system, and this is the feeling system of the brain, and you can see it's in that lower middle part of the brain. And the important thing here is this is what the amygdala looks like, and remember, it is the worry center of the brain. It's the Greek word for almond, so it's shaped like an almond. That's how I always know what the amygdala looks like. It's the almond structure in the brain. And then right next to it, this little jelly roll looking thing, that's the hippocampus, and that's the memory center. So again, memory, trauma, memory, trauma. Trauma is very well remembered, because they're next door neighbors in the brain. And trauma is in the eye of the beholder. That's the other piece we need to remember, is that something that may seem very insignificant to us and unimportant can be huge for a child. So it's really important that we don't minimize it, but that we talk more about what it is. Cheyenne, do you mind if I just tell a little story about our conversation tonight? Okay, all right. So we were having dinner tonight, and she was asking me what I was going to be talking about, because I regularly babysit my granddaughter on Tuesday evenings, and I told her anxiety, and she said, what's that? So I thought, well, this is really a great opportunity. So we talked about what anxiety is, and that constant worry and fear about things like losing friends, or that we're not going to do well in school, or that our pet might die, or those kinds of things. And she said, oh, I have I have some of those things that I worry about. And I was thinking, how often have I really asked that of her? We had this perfect opportunity tonight. But even just driving in a car saying, I worry about losing my job sometimes. Do you have any things that you worry about? And asking kids to share what their worries are is really important to get them out there. Because oftentimes they think something's wrong with worrying about things. Our brain is comprised of all of these neurons, and the neuron has a cell body, so that's that thick part up there, and then it has an axon, which is kind of like a thicker tail, and then all those little things that are branching out are called dendrites. And sometimes we talk about dendrites as the magic trees of the mind, but they're the kind of brain structure that keeps growing and connecting with other dendrites and with other nerve cells. And what happens is the more we learn, the thicker the dendritic mass gets in the brain, and the more connections we make in the brain. So what we want to do with kids who have anxiety is make some connections to calm. And that's why those mindfulness activities are so important. Let's think about ways to calm. And once the kids have that down, then that's where they can go. And we used to be thought that we had about 100 billion of those. Now maybe 200. I mean, we just don't know. People keep estimating, how many neurons and neuronal connections we have in the brain. We know it's trillions of connections, but we don't really know. There used to be a myth floating around when I was in high school that if you had too much to drink, you lost 20,000 brain cells. I was thinking, well, they didn't even have scanning technology again. Somebody made that up, probably in a bar. So nobody really knows. We'll put it at that. But we do know that a lot of alcohol consumption is not good for the brain. So here's what those neurons look like as they're migrating to where they're going to go. So this is at birth, and this baby is born with neurons that are headed for where they're supposed to live. Some are going to go to the visual cortex and help improve vision. Others will go to hearing. Others will go to different sensory parts of the body. And the body in a toddler develops from, the top down, so that the very last, toddler skill is that walking and running and maintaining balance. But the vision starts to develop fairly early on. So at 3 months old, in this particular baby, all of these connections are made in neurons. That's how fast the neuronal connections grow. Think about this, however. If this child is living in trauma, if this child is being abused, if this child is being neglected, whatever might be happening with this child, all of those connections are being strengthened. And they're the connections that will not serve the child well in life, but may enable them to survive in their current environment. So that's the piece that we have to remember, is our brains do get hardwired, so to speak, and it takes a lot of intervention and support to undo these early traumatic links that are made. At 2 years of age, this explains the temper tantrums in the grocery store, the biting other kids in preschool, all of that kind of behavior, because the child has too many connections, doesn't know yet which ones are useful. So at this age, the brain starts to prune the connections and say, that one isn't very useful, I got time out for that, or my grandma walked away from me, or something negative happened, so I'm going to quit doing that. So the brain is, whether consciously or not, the brain is making those kinds of calls. So here's what we know about the brain. The fastest brain messages travel at 360 miles an hour. We think about 200 billion neurons, and each one can be connected to thousands of others, so that there could be about 1 trillion different routes in your brain that messages can take. And each brain cell may receive hundreds or thousands of incoming signals every second. And when we think about brain input and all of the input that we could pay attention to or not pay attention to, there are a lot of signals that our brains get that we just screen out. So we're able to screen out unimportant things. There's a noise going on in the background here. Most of us have habituated to it, and we're not paying any attention to it. Some of us, it might be continual botherance to us. So anxiety. So what happens in the brain with anxiety? So here we have a depiction of an axon terminal. So this is the very end of the axon. So here's this cell, the nerve cell, the body of the cell. Here's the axon. And when the axon comes to an end, it sends neurotransmitters to the next nerve cell. And what's great about our brains is just kind of brilliant. We have calming neurochemicals like serotonin. And so serotonin just makes us feel, all's right with the world, very zen. And so when our brains are working properly, the serotonin just flows to the next place. If we're not under duress or under stress, flows to the next neuron, to the next, to the next, to the next. When people have anxiety, what happens is that the neurotransmitters that are responsible for well-being, instead of flowing through here to these receptors and going to do their calming work, they get reabsorbed into the brain before they have a chance to do their work. So the serotonin goes somewhere where it's not useful. It goes to a different land than where it's supposed to be. And that makes us feel anxious. We don't have enough calming chemicals. And that's the neurochemical explanation, I guess, for what happens with anxiety. So the big three neurochemicals, so those are the three big ones. Usually when there's a mental health issue involved, it's going to be one of those three neurochemicals. There are others, GABA, there are like 100 and some neurochemicals in the brain. But the ones we hear most about generally are dopamine and serotonin and sometimes norepinephrine. And norepinephrine is the same thing as noradrenaline. So adrenaline and norepinephrine are the same thing. It's just a British term and an American term. So what we can see here is that when the dopamine in the brain, when that flow is impacted, there are certain structures that are affected. And in serotonin, there are other structures that are affected. And what happens in the field of psychiatry, and I'm not a psychiatrist, so I'm just speaking very basically about medication, is that sometimes a mental health disorder looks like something that could be serotonin involved or could involve a different part of the brain, but it doesn't quite make the mark. So lots of times when people are on medication, one doesn't work, they might try another. With teenagers, by the way, lots of times cognitive behavioral therapy is very effective alone. The research shows, though, that with medication, it's the most impactful in dealing with things like bipolar and depression. So generally, the combination, lots of people benefit from therapy alone, from mindfulness activities, from exercise, from living right, spirituality. There are all kinds of holistic approaches as well as the medical interventions. This is an illustration of a young man whose frontal lobe is fully developed and his amygdala has calmed down. He doesn't get bent out of shape about everything like his little sister, whose amygdala is on fire all the time and her frontal lobe is not quite developed. So here he may have borrowed her iPad and she got really upset about it because her brain isn't quite mature enough to really absorb that. That's okay. Usually you get it back, She's just been out of shape about it. And while she's yelling at him and scolding him, he's just thinking, whatever, it's my kid's sister. So he has the ability to put that in perspective. So just to show you what can happen on these images of the brain that we're talking about is this first image on the left is a normal view. And it says normal, but that really isn't a normal brain. That is rather atypical. There are about 1 in 1,000 brains that look like that, but it's a healthy brain. So that's a healthy brain in that it doesn't have the impact that these other brains have. And these other brains have been impacted by things like heroin use, methadone use even continues to impact the brain. So you can see this brain is pretty darn healthy. The psychiatrist who took this brain image had to scan 1,000 patients before he found this one. He was having a really hard time finding a healthy brain. In fact, he was sitting contemplating how difficult it was one day, and he thought, who's the healthiest person I know? And he thought of his mother, because his mother grew up in an era where she lived on a farm, ate well, never used chemicals, never drank, never smoked, was what he thought was very mentally healthy, a good person, didn't have mood swings, that kind of thing. And so he thought that he would scan her brain, and sure enough, she had a perfectly healthy brain. Don't see many of these around, though, especially these days. Everybody in this room probably has a little bit of brain damage, so we're all in good company. So these are the most common childhood mental health disorders. And so we'll get started on anxiety, but I wanted you to have the context for what the other ones are. Depression and bipolar disorders we're seeing a lot of in schools, ADHD and disruptive behavior disorders. And disruptive behavior disorders are those behaviors like oppositional defiant disorder or conduct disorder where there's criminal activity and people are often harmed. So those are the three clusters. So what we're focusing on tonight will be the anxiety. So before we get into this, let's everybody stand up and just do a nice big stretch. And stomp your feet if you need to, just to move around a little bit. And then turn around 3 times. And then go ahead and have a seat. So it's always good to rub and polish our brain against that of others. And so what we will do is after we talk about some of this material, I'm going to ask some of you to talk about specific situations you've either heard about or seen, or could even be a TV show that illustrates some of the things that we're going to be talking about here. So first of all, we're going to start with forming a group of 3 to 4, and if you want to just turn around if you're sitting in a row where it's sparsely populated, and just talk about why educators and parents need to know about effective home and school-based interventions for children with mental health disorders, and then what you hope to gain from this training. Those 2 things, if you would just process with your partners, why we need to know this stuff and what we hope to gain from the training. Go.